There are thousands upon thousands of career choices out there. Do you know which one you want to pursue? Some people have no clue. Others have known for years. Personally, I'm more of a hands-on guy, and I love and I enjoy to help people, and that's what led me to want to become a nurse practitioner. Nurse practitioning is a career that grew on me as I was working as a medical assistant at a gastroenterologist throughout the pandemic. I was able to determine firsthand the difference between the care of a doctor and the care of a nurse practitioner. I came to a conclusion that doctors are usually less detailed and took less time than the patient than a nurse practitioner. Nurse practitioners usually provided better care and had a higher satisfaction rate than that of a doctor. Doctors would usually have the patients complain to me about wanting to see a different provider, and that provider would most often than not be the nurse practitioner, and after those visits they would be content with their care. Luzine Pogazian from the Washington Post, who herself is a qualified and experienced nurse practitioner, believes that nurse practitioners do not need the oversight of a doctor. She believes they should be able to start their own practice, which in part would save people money. She goes on to say, there are many ways to expand healthcare. One promising idea, which wouldn't cost taxpayers a dime and may actually save money, is to expand the role of highly trained nurse practitioners. Again, she believes that allowing nurse practitioners to start their own practice can save money and at the same time still provide the quality care without the oversight of a doctor. Furthermore, Dr. David Scales on when it's okay to see a nurse practitioner, physician's assistant, and when it's not, says, seeing a PA or a nurse practitioner can streamline your care. And what does Dr. Scales mean by this? Well, sometimes when you have to wait for a doctor, whether it's family care, whether it's a specialty, you're going to have to wait weeks, sometimes even months. But if you're willing to see a nurse practitioner or even a PA, it can make your treatment come to you a whole lot faster. Your appointments will be a whole lot faster. And more often than not, the quality of that experience is going to be way better than if you were to actually wait for a doctor. Dr. David Scales even goes on to say, a nurse practitioner with 3 decades of experience may be more knowledgeable than even a doctor. That just goes to show the quality of education that nurse practitioners have to go through. And that just shows the quality of care that they can attend to you with. So there is no right or wrong career choice. Everyone is different. Just make sure you end up doing something you truly love and something you truly enjoy doing. Don't just do something for the money. You'll be miserable. Make sure you do something that you see yourself doing for a long period of time. Trust me, you'll live a happier life. And do not settle yourself for less. Remember, you can really do anything you put your mind to. Whether you want to be a doctor, whether you want to be a nurse practitioner, whether you want to work construction, or whether you want to work at McDonald's. If that's what makes you happy, then go for it. Don't let anyone's opinion tell you otherwise.